In this video, I will be demonstrating an ACL rupture and a large bucket handle meniscal tear. As you can see, the medial meniscus is almost displaced, not only from the posteromedial but also from the anterior slight medial side. We have repaired the posteromedial with all inside technique, which is very common. And with the help of a probe, you can still see that the meniscus is still not fully repaired, and there is still some anteromedial part, slightly medial more, which is still displaced. So we will be demonstrating in a situation like that what instrument to use. So this instrument is called Sharpshooter. It has got a nice angle, and the technique is called inside out. With the help of Sharpshooter, you identify the location and the needle is passed. The suture is already attached and it comes out of the skin, making sure you do not damage any neurovascular structure. Normally, if you're quite anterior and medial, there is no major structure going. The second suture is passed from the same shuttle, mostly on the top part of the meniscus over the capsule, and then remove the stitch. The two ends of the needles which are passed out of the skin are cut, and in this video you will see the stitch will hold the meniscocapsular junction very nicely. You make a small nick from outside the skin, identify the suture, and then tie them. Mostly 6 times you need to throw, and then as you can see, it nicely compresses the meniscus, and the final repair will show satisfactory position of the meniscal repair.